بسم الله الرحمن الرحيم. بهذه المحاضرة حنشرح عن تينيا باربي والتينيا فيشياي. Tinea barbae, ringworm of beard area, also known as tinea psychosis and Barber's itch. psychosis جاية من كلمة psychos تعني تين يعني فك. التين لما نفتحه يكون يعني يشبهوه بالباستيولز والبابيولز اللي موجودة بالتينيا باربي من الداخل. is more common among those in agriculture pursuit اللي يشتغلون بالزراعة, especially those in contact with farm animals, but may also be seen in restaurants and through incidental contact. يعني بالمصارعين أيضا ممكن تكون موجودة. The involvement is mostly one-sided on the neck or face. Typical scaling alopecia patches can occur in addition to a more inflammatory superficial, crusted, partially pulped patches with folliculitis or deep nodular suppurative lesions, possibly indicating a zoonotic infection. كل ما يكون inflammation أكثر ممكن تكون zoonotic. الأنثروبوفيليك تكون أقل يعني inflammation من zoonotic infection. The deep type developed slowly and produce nodular thickening and carrion-like swelling, usually caused by Trichophyton mentographids or Trichophyton verrucosa. As a rule, the swelling are confluent and form diffuse podgy infiltration with abscesses. The overlying skin is inflamed, the hair are loose or absent, and pus may be expressed through the remaining follicular openings. Generally, the lesions are limited to one part of the face or neck in men. The superficial crusted type is characterized by a less inflammatory pustular folliculitis and may be associated with Trichophyton violacea or Trichophyton rubrum. The affected hair can sometimes be easily extracted. Rarely, epidermophyton flucosum may cause widespread verrucous lesions known as verrucous epidermophytosis. Diagnosis. The clinical diagnosis of Tinea barbae is confirmed by microscopic mounts of extracted hair or biopsy and culture of the tissue specimens. Differential diagnosis. The differential diagnosis include staphylococcal folliculitis, psychosis vulgaris, and herpetic infection. Tinea barbae differ from psychosis vulgaris by usually sparing the upper lip and by often being unilateral. In psychosis vulgaris, the lesions are pustules and papules pierced in the center by a hair, which is loose and easily extracted after suppuration has occurred. Herpetic infection usually demonstrate implicated vesicles. T-zinc preparation has a low diagnostic yield, but viral culture or direct fluorescence antibody is virtually always positive. Treatment. As in Tinea capitis, oral antifungal agents are required to cure Tinea barbae لأنه قلنا بها hair follicles فتحتاج oral antifungal. Topical agents are only helpful as adjuvant therapy. Oral agents are used in the same doses and for the same duration as for Tinea capitis. نفس الجرعة اللي أخذناها سابقا. Tinea Faciei. Fungal infection of the face is frequently misdiagnosed. يعني تقريبا أكو دراسات تقول نسبة 70% من التينيا فاشياي misdiagnosed. Typical annular rings are usually lacking and the lesions are exclusively photosensitive. Frequently, a misdiagnosis of lupus erythematosus is made. Biopsies for direct immunofluorescence often demonstrate some reactants on sun-exposed skin, adding to the possible diagnostic confusion. يعني إحنا already أكو confusion with lupus erythematosus وأيضا البيوبسي ممكن يزيد هذا confusion. Erythematous, slightly scaling, indistinct borders may be present at the periphery of the lesion and are the best location for KOH examination. من البوردرز ناخذ العينة على مود KOH examination. If topical corticosteroid has been used, the lesion will expand, and fungal folliculitis is a frequent findings. A biopsy may be required to establish the diagnosis. A high index of suspicion is required because fungal hyphae may be few in number or confined to the hair follicles. The inflammatory pattern may be psoriasiform, spongiotic, or vacuolar interface. The latter pattern has the potential to perpetuate confusion with lupus erythematosus. Usually, infection is caused by Trichophytolubram, Trichophytometigraphids, or Microsporum canis. Tinea faciei caused by Microsporum nanum has been described in hog farmers، يعني باللي يشتغلون بالحقول مع الخنازير. If hair follicles are infected, such as long eyebrows or beard area in older children, or infection is widespread, oral medication is required. Otherwise, the infection generally respond well to topical therapy. إذا area بها hair و thick hair بالolder children أو بالadult هذه تحتاج systemic therapy. أما إذا كانت بarea with fine hair أو بالchildren فهذه تحتاج topical therapy عادة تستجيب إلى. وهنا صور على التينيا فيشياي، هنا حوالين بالأوربت صايرة، وهنا تينيا فيشياي بالجو صايرة.